And we're back. I'm Dr. Yassir Sonbol. Let's dive right back into today's medical conversation. Welcome back, everybody, to Real Medicine, Real Lives. And are you enjoying the show? Want to catch more of these shows and other shows on live or on demand? Anytime you like. Download the free Now Media TV app on Roku or iOS and unlock nonstop bilingual programming in English and Spanish. Are you on the move? Catch the podcast version at www.nowmedia.tv. From business to news and lifestyle, culture, and beyond, Now Media TV is streaming around the clock, ready whenever you are. All right, so I'm going to close this conversation with the founder of Off Scripts, Ross Van, and we want to take a look at the bigger and full picture to our work together. She supports patients through personalized health consultations, helps pharmacy professionals through career coaching, offers business consulting, and contributes clear medical communication through writing and review. The combination matters because healthcare does not happen in only one place. It happens in clinics, pharmacies, homes, screens, conversations, careers, and daily decisions. This final segment is going to be about empowerment. How do patients become better prepared? How do healthcare professionals reconnect with purpose? How do we make medical information feel less intimidating and more useful? And how do we keep the human being at the center of the healthcare conversation? So Ross, when somebody comes to you for a personalized health consultation, what are they usually hoping to understand and get more clarity on and in more information?
Sure. So I noticed that they usually have a goal in mind, and they're pretty blunt with me. They'll just share it with me. So someone would come and ask me why, for example, their healthcare provider did not let them decrease their Apixaban dose, even though they requested for this. And I apologize. The brand name for Apixaban is Eliquis.
Mm-hmm.
The other thing they might actually tell me is they just received their genetics test result. Even though someone has already tried to explain it to them, they're still very confused.
Mm-hmm.
So they will ask me to try to help them better explain this to them. Other people would also ask me, "Hey, why is nothing working for my condition? What can I do?" And another question, of course, that I keep mentioning over and over is definitely natural medications. There's been definitely an increased interest on how to safely combine prescription medicines and natural medicines.
And so how can patients better prepare when they come to see you or come to see their doctor or any sort of consultant, get better prepared with better questions before meeting them?
Sure. So I think we definitely mentioned it a little bit earlier, but definitely if they want, learning beforehand is totally fine. They just need to make sure their sources are reliable and prepare a list of questions. Sometimes the list can be very long, though, right? We all have a lot of questions, especially if this is not our specialty. So I would like to encourage them to focus on their top three things or questions that they would like to achieve at that visit. And then at the end, they can share maybe the next few things that they would like to achieve during the next visit, and it would help the clinician be able to prepare for the next visit as well. Of course, I keep re-emphasizing this. Don't be afraid to ask questions, or else you won't get an answer. But the other thing also is if the answer is overwhelming, please speak up, right? Ask the clinician to explain things in a different way because everyone learns and inhales information differently. And if you share how you learn information best, like if you're a visual person, for example, things like that, then that would actually, the clinician can learn and adapt to you because they want you to succeed as well. But they need to know how you prefer to learn this information.
Great. And so what have you learned from coaching, pharmacy colleagues about burnout, reinvention, and professional purposes?
Sure. So I've learned that it's more like it gets re-emphasized that pharmacy colleagues are humans too, right? They're
Mm-hmm.
successful, but they can also experience self-doubt, just like any of our patients and our caregivers. So I've learned that all of my colleagues have the knowledge and skills all along, and I share this with them. And once I am able to pick out certain examples of their current experience that they've shared with me and how it's transferable and relevant to an unfamiliar setting that they want to transition to or in unfamiliar situations, you can actually see like a light bulb that goes off in them. You know, their eyes start to sparkle and they get a lot more motivated and realize that this is possible.
And how does your work in consulting, pharmacy, and medical communication, all connect under the mission of off-script consults?
Sure. So I started off script consults because I wanted to create something of my own, where I can dictate what services that I feel is important that needs more attention, where I can have more of a positive impact. I also wanted to be in charge of my own schedule and achieve better work-life alignment. I also have a passion for education, wellness, and writing, and off-script consults allow me to do all of these things. And what I've noticed is a lot of people also want to achieve these things as well, right? They have their own goals, and I can help them achieve their goals as well. And sometimes from personal stories of what I've been through or what my brother has been through, he's also very inspiring as well. And stories from other people too. And it gets their blood pumping, right? And it gets them want to achieve their goals.
Gotcha. And what's a practical habit viewers can start using today to feel more confident, more organized in their healthcare decisions?
So I believe we also hinted at this earlier too, but a change in mindset, right? Viewing a pharmacist as less transactional and all clinicians actually, instead of seeing any clinician as being out of reach, see them as more being more in reach. And I think that that mindset helps you realize that they are there for you and they're meant to be there to help you. And of course, like I mentioned, let's see, this is their life. So if they don't need permission from anyone but themselves. They need to take control of it. And then after they take control of it, they will realize any doubts that they have, any doubting voices, it just gets quieter. It doesn't matter as much. And of course, I am always encouraging for them to learn more and bring their questions to their clinician and focus on top three things. Just do a few things at a time. Don't try to overwhelm yourself. I guess that's the best practical thing they can do, right? Is don't overwhelm yourself. Focus on three things at a time.
Hmm. Yeah, that's true. And so, tell us, what made you get into this, this part of it, the medical writing and the consulting, and not just pharmacy and just giving people pills and and things like that. I mean, what inspired you to do the other part of this?
Sure. When I was in pharmacy school, I was actually debating about pursuing the PharmD PhD program, and so the dual degree. But then I decided not to. I decided not to continue with the PhD part of it. A part of me still misses it a little bit, but I think maybe you might have noticed at this point, I'm a little bit more interactive and a people person. And
Mm-hmm.
hearing the HPLC machine click away, things like that, I definitely needed more interaction. So I decided to stick with pharmacy. But a part of me still missed the writing part, the analyzing, gathering data, noticing trends, things like that. And that's, as you can see, how the medical communication comes in hand. But when I got out of pharmacy school, if I wanted to pursue anything more than, like you mentioned, just dispensing medications, it looks like I had to do residency at that point. So a part of me have always wondered, can I do all the things I love with my PharmD, no residency, no PhD training, and so learned how to. That's how I started working at different pharmacy settings was I showcase myself as a person with all these knowledge that can be transferable or translatable to the position or opportunity at hand. And I am convincing. So, the person who interviews me gives me a chance.
Mm-hmm.
Right. And then people started asking me about my journey. How did I do all this? And then
Mm-hmm.
that's when I was like, okay, maybe I should also do coaching because people
Mm-hmm.
ask me, how did you do this? And I want to do it too.
Gotcha. And just one, if you take a minute, one more time, I just want to go back over, cost and drug medications to close it
Sure.
out. And if you can give people, I know you mentioned, the pharmacy, or not the pharmacy, the pharmaceutical company has, ways to help people, be able to get medications that are expensive. What are just some other resources people may or may not be aware about? I mean, obviously we see things like GoodRx, et cetera. How helpful are these things? And is there other things like that so people can just kind of plan ahead before they come to the pharmacy?
Sure. So there's something other than the pharmaceutical company, there's also something called Needy Meds as well. You can look and you can search for your medications. And when you do that, they will actually tell you everything that's available to you. They'll give you a list of the pharmaceutical company. They will also give you things like RX Outreach, which is a nonprofit pharmacy that helps people where their insurance isn't covering their medications or they don't have insurance at all. There's other patient assistance programs out there too. And these programs, they actually are usually based off of the medical condition you have. A lot of these programs, though, do keep in mind you do have to actually apply for it once a year. And when you apply, you need to make sure you meet the eligibility criteria and things like that. And that's where probably the pharmacist can come in and help you because all of these forms can be very intimidating, all of this information. But the pharmacist can read through it real quick, fill it out in half the time that you yourself is filling it out. And that can be part of the consultation. And then they can even submit it for you, talk to the program coordinator for you or the manufacturer for you,
Mm-hmm.
and make sure that you're getting your medications delivered to your door at little to no cost. Like you mentioned, there is GoodRx. There's also other things as well, such as pharmacychecker.com. That one is for certain patients who, for example, their insurance don't cover their brand name medication at all, and it's the only thing available, right? Like, for example, you mentioned Plavix a long time ago. That was the only antiplatelet available, and there was no generic for it yet. There's no other alternatives. Or let's say a patient has no insurance at all. That's also one other resource that can be used. It's been recommended by JAMA as well. And I think JAMA gives a really good table where it actually tells you all the different resources out there for certain patient types, or what each patient is going through and what each type of resource would be best fit for that patient. So I think that's a good example. And of course, if you visit my website as well, I also have an article on there about nonprofit resources that can be used too. So if you go to under let's see, let's go to wellness seekers and go to resources, for example, and then you can scroll down.
Mm-hmm.
Then you actually see an article that says nonprofit resources, and that will give you a
Great.
list of all resources that you can use.
Perfect. Thank you so much. Well, we're
Yeah,
going
of
to have to
course.
wrap it up here, but I really appreciate your time today. And to everyone watching, we keep inviting you to ask questions, keep seeking clarity, and keep remembering that your health decisions deserve time, care, and understanding. Stay connected for more on Now Media Television. Uh, this is Dr. Yassir Sonbol. This has been Real Medicine, Real Lives. Today we try to make sure that healthcare becomes more powerful when patients understand why they get the care that they do. And this episode, we enjoyed Ross Fan for joining us, and we'll see you next time.